Pediatric emergencies. So once they're born and they become neonates for a few days, then they become pediatric. So what is the problem with pediatrics? Why are they so difficult to deal with? And the reason is because none of them are the same. There are so many different ranges, as you can see here, and you cannot treat an adolescent the same way you would treat a toddler. Toddlers are different from school-age kids. School-age kids are different from, infants. They're all different. So we say pediatrics, but really we're dealing with 5 or 6 or whatever categories of different age groups, and none of them are the same as the next one. So that really, the development stages, really what causes us a lot of difficulty.
Isn't peds until 21?
No, that's just the hospitals sometimes decide that. According to us, pediatrics is till about 18.
That's what guys living in their parents' basements don't feel so bad.
But that usually has a play.
So,
What's it called?
According to Obama, it's still 26.
So, pediatrics have larger head sizes in comparison to the rest of their body. It is out of proportion. Therefore,
They can't do this.
they get head traumas. Okay, they get head traumas because they have big heads. Also, they lose heat quicker than adults because most heat loss happens through the head. Test question. Where's most heat loss? Oh, I woke Ellie up.
Also, there's
Like old
less
guys wear hats.
subcutaneous tissue. I don't.
Good job.
Next, fontanelles. There are 2 things that we see or we should look at in the fontanelles on infants. Fontanelles are what's known in America as the soft spots. We actually call them the fontanelles. But there are 2 things that we can look at in the fontanelles and actually give us a picture as to some of these things that are going on. Bulging fontanelles. If you see bulging, meaning the skin is not flat, the skull, there's actually a bump, that would be called bulging fontanelles. This may suggest intracranial pressure. And the most common form of this would be meningitis. All right, meningitis. I don't know if I ever told you a story that happened to me last summer in the country. I was driving someplace and they saw me pass, and the base asked me if I could return to that call. So I went back and I see Mom, who was, 17, Bubby, who was like 30, and baby. Bubby's holding the baby, and she tells me, we just came from the hospital. The doctor told us that the baby has meningitis, and we need to be taken right away to Cornell or Columbia or wherever it was. So, and the EMTs are standing there like, I don't know, whatever the doctor said, so must be right, yeah? All right. So they called me back and I go over there. So I go over and I say, let me take a look at the baby. Let's go inside the ambulance. In we go. Me, Mom, Dad, Bubby, baby, and a few EMTs.
So combined age of 90.
Pretty much.
Ellie was there. 16 people in a clown car.
So I take, have Bubby pass the baby, hold it, and I start feeling, what am I feeling for? Young baby, I'm feeling for. Fontanelle? Bulging? Nothing. Flat as a pancake. Perfect the way it's supposed to be. I tell Bubby, good news. He ain't got meningitis. Yeah, the doctor said. I said, okay, the doctor said. I'm telling you, the baby does not have meningitis. Yeah, but we took the temperature and it had fever. I said, okay, baby has fever. That's possible, but not meningitis. I said, if the baby had meningitis, what right does he have to let you leave his office with the baby? Should have called us from there. You can't just let a baby walk around a bungalow colony with meningitis. Are you out of your mind?
Did you do that in Yiddish?
Is that opposite?
So I said,
Meningitis?
this is not meningitis. So H-Base was waiting for me to approve an ambulance going to the city from the country. I told them, absolutely not. I am not approving this transport. And I said
Go back to the doctor.
to the Bobby, I said, you want to get in your own car, put the baby in a car seat, drive to the city, more than welcome to do that. I said, if you get any problems with the baby along the way, here's my cell phone number. You call me, I will arrange for a solo member to meet you wherever you are. From here to the city, I'll have someone meet you and deal with the situation.
Helicopter up there, right?
So they were angry.
Why don't you tell them to go back to the doctor?
They were angry that their baby didn't have meningitis.
They were angry that I was saying that their doctor didn't know what they were talking about. They were very angry. Why won't you take us? You're Hatzali. You gotta do what we need, you know? So I was really nice. I explained to them numerous times in numerous languages that
Maybe that was why they were angry.
that this baby is 100% fine and does not need to go to Cornell, and there's no way I'm letting an ambulance leave the Catskills,
6 hours.
right, for all those hours, and on a Matzah Shabbos, right? Sunday's the biggest day for calls.
Don't they usually do a handoff that another one meets it somewhere up north?
Yeah, it's possible, but this was very late at night. I was coming back from a bar mitzvah, it was after midnight, very difficult to do that. Okay? So the bottom line was that I get home, I go to sleep, I wake up in the morning, and I send a text. I made sure to get the father's phone number,
The mother's not allowed to have a cell phone.
No, she's a pediatric parent, you're not allowed to have cell phone.
okay? I made sure to get his phone number. When I gave him mine, I made sure that I called his. I send him a text. How's everything? How's your baby? So this was midnight that I was there with them. He told me the baby's fine. We were back in the country at 5 a.m.
Relative country.
Okay?
Oh, they went themselves?
They went themselves.
Good for them.
Smart.
Where's the doctor in all of this? Did you get that doctor?
No.
This is why you're treating you're teaching doctors.
Hold on, where were they? EMTs and all of this.
They are.
That's on quiz 4.
Alright, this was maybe a little difficult for them to
So
actually
nervous.
to go up against.
Yeah, how does nobody
My third call.
call
ever.
you on all
I'm sure
your,
it's probably like,
you know,
I'm patient.
your revelations and
Just
your,
for the
your
record, any
decisions?
Gonzalo member that I.
Meningitis will
told me
always
they-
have bulging
They have
fontanelles.
Eli on the call.
Like you
It's
just
actually very
you state these things. You're like, I don't
He's
care
not-
what
he's
this
not-
quack says.
Right.
This guy with a PhD, MD, you know, it doesn't matter who it is, Stephen Hawking, and you're just like, I don't care what this quack says. I'm Eli. That's it.
Right.
I'm surprised.
This is what I
But I'm
do.
so surprised it's never bitten you in the ass.
Yes.
Allie, after the class, you need an 18-wheeler, 18-seater. We're all just gonna jump on the car with you. And
No problem.
Mid compression, I'm gonna be like,
Sunken fontanelles, where there's a dip in the fontanelles. This could be a sign of dehydration.
maybe you.
Oh.
Not speakerphone.
I continue.
So, I wouldn't worry about any of this stuff. I hate tables, especially if I didn't make them. Let's talk about this. So, there was a famous pediatrician who was giving a lecture to a big group of doctors. And he gets up and he asks the group, huge auditorium. And we were all listening, and he says to the group, what does ABC stand for? So, as good practitioners, everybody answered, airway, breathing, circulation. He said, no, not in pediatrics. In pediatrics, it stands for airway, breathing, check the airway, and breathing again. Okay? What does he mean by this? What he means is that pediatric emergencies
Don't have heart attacks.
are usually based on a respiratory problem, okay? And so we come up with these three big words: respiratory distress, respiratory failure, and respiratory arrest, which is the worst.
Arrest.
Respiratory arrest, very good. Now, respiratory distress is anything you could imagine that has to do with the respiratory problems, all right? So it doesn't matter if it's stridor or wheezing or rhonchi or grunting or any of these things, doesn't matter. These are all in the family of
Distress.
respiratory distress. You want to get there and recognize respiratory distress, okay? Failure is already when the SAT, the O2 SAT, which we've spoken about, starts to fall, all right? When other things start to happen that change what is going on inside the child, this would be failure, okay? And arrest is the next step after that, which is
Stop.
stop breathing altogether. Okay? So, distress, all these things, use of accessory muscle use, nasal flaring, head bobbing. Have I ever spoken about head bobbing? Many times you'll see a very sick kid, very sick young child, and this always happens, the same scenario. You come on scene, you'll see the child cannot keep its head up. The head bobs like this, okay? And you ask mom, why is the child doing that? And she always says the same answer. He's tired, he missed his nap, or he didn't sleep properly at night. No, that's not the answer. The head bob is an extremely ominous sign. That child is going to die if you don't do something. Remember this, the head bob is ominous. That means something bad is going to happen. Deal with it. Okay? Don't let mom tell you he's just tired. What?
Until what age does that really apply? Because you have like a 2-year-old. that-
Toddlers.
Up to a year?
2.
From when? Wait.
Till when?
Stridor, wheezing, rails, grunting. Grunting is something that really EMTs don't get to. It's the sound of lung disease. Okay? And here, indication of respiratory distress becoming respiratory failure. You know about stridor and wheezing, right? Stridor, tell me something about stridor.
It's on the inhale.
Okay, could be on the inhale, but tell me something.
Upper airway.
Upper airway.
Wheezing is lower.
Very good, wheezing lower. Right, more things, okay? Nasal flaring is where they open the nares of the nostrils very wide. Pursed lips, this is a way of changing intrathoracic pressures. They breathe through a very small, tight space. Cyanosis. What does cyanosis always equal?
Smurf. Hypoxia.
Smurf, right? Smurfosis. Hypoxia, very good. Stridor, we know upper. Wheezing, we know lower.
What is
Tachypnea. What does that mean? Fast breathing. Tachycardia. These are compensatory mechanisms. Accessory muscle use. Decreased muscle tone. Lethargic. Right? Lethargy. Poor peripheral circulation. Right? We'll talk about in a minute. We'll talk about cap refill. Okay? And abdominal muscle usage. When you see the belly, seesaw breathing it's called. The belly with the chest. Up and down. Right? All these things show you that this child is in respiratory distress. Don't let mom say, okay, I'm going to put him back for a nap. No, into my ambulance, please. Let's get some oxygen on this baby. Let's go to the hospital. Alright? Quest ALS.
What does stridor sound like?
Stridor sounds like a seal-like cough or bark. Like
You won't get it on the scope.
no, usually you can hear it without.
As the cough.
It's upper airway. It's above the vocal cords. So croup, it's an inflammation of the upper airway, right? Viral infection. If you don't know this by now, you need to know. Croup, stridor, upper airway. You'll be tested on this over and over and over.
Stridor is a sign and symptom of croup? Is that
Yes, yes. It's the noise that you hear. It's like a bark. Let me tell you one thing about Croup. Moms get very, very nervous, very anxious. Croup typically does not kill anybody. Just sounds horrible, frightening.
Do that. Oh, it's recording.
It's like a seal, like a whooping call.
What the hell is that?
No, that's something different.
Like a barking.
Bark.
Yeah.
Epiglottitis.
That's the tightest.
Inflammation of epiglottis.
Very good. This is
Wow. You just read the board.
That's the EpiPen.
Man, stop stealing my thunder.
See, now you know how it feels.
Add itis to any word, it means inflammation.
Yeah.
epiglottitis. This is unfortunately a life-threatening disease that children have. They don't often make it through epiglottitis. Now, I would say that in the 90s, we completely eradicated it in the United States. You know why? Because everybody immunized their kids. And there's no immunization for this, it just went away. Because everybody was immunized. Guess what happened starting the millennials or whatever?
Came back.
Right? And they stopped immunizing. We started seeing this. Okay? Now, the problem with this is in the paramedic protocols, there's one line for epiglottitis. Do not intubate. Because once you advance anything into here,
Stuck it.
it'll just snap shut. And then they die.
What?
So, yeah, this needs heavy antibiotic treatments.
If you put a tube down there,
They're not going to get it through.
oh, they're not gonna get it through.
No, it's going to close.
And they gotta go into the lungs.
So what do you do,
No.
can't even do the-
No,
Nothing.
nothing. It's a big problem. It's life-threatening.
Bronchodilator.
Okay? There's really no treatment for it except for antibiotics and prayer.
Why doesn't EpiPen help?
It just won't. It's not. It's an infection that's closing the airway. Right? Bronchiolitis. Obviously, this means what? Inflammation to what? Bronchioles. Very good. Very young children, usually till about 6 months. Bronchial inflammation. Okay? They need medication. AMS. Now, watch this. This is going to be really fast. AMS in children is the same as AMS in adults. All the same thing. Hypothermia in children, same thing. If they shiver, is it better than non-shivering?
Yes.
Yeah, he should have made his way back to this slide, my shivering man.
No, when he was a baby.
I didn't even do this.
Oh, okay.
Hyperthermia is not the same.
Alright, fever and infection.
You're about to say hyperthermia is not the same in children.
Right.
Yeah.
Fever and infection. They don't have, very young children don't have the immune system that the adults have that they can fight off fever. So, up to 2 months, all right? Anything, 100 and over, goes to the hospital. We don't play games. Right now, 100, we would just call in an adult low-grade fever, suck it up, right? Not in a baby. Not in a baby. Baby, we take this very seriously. Remember, seizures in children of all ages. Seizures in children, most common form are? Febrile seizures. Very good. Poisoning, heart disease are very rare, and all this other stuff. Fever.
Why did I get it
So,
wrong at the exam? Alright, never mind.
fever.
Maybe we'll find out.
I did the same.
Bulging fontanelles is possible what?
Meningitis.
Meningitis. So fever with bulging fontanelles may be meningitis. Or if they don't have any bulging fontanelles, then
you can
the
go to
doctor's
Cornell.
an idiot, right?
You go to
Good.
Cornell without
What's it
it.
called? Idiopathic.
Idiopathic? Nah, he's just idiot. Alright. Sunken eyes, sunken fontanelles. Alright? Inability, they're crying, but there are no tears. Stuff like that. Possible dehydration. Febrile seizures, guess what? Tonic, clonic, but this is not a central nervous system problem. This is because of the rate of change of temperature. It's not from the height of the temperature. It is from the rate of change. These are mathematical terms. It's how fast the temperature moves up or down.
How fast?
Rate of change.
How fast can it do? Like, is
Oh, it can happen very quickly and then they seize.
So they go.
Meaning if it goes up 1 point every day for 5 days and gets to 105, they won't seize. But if it goes from 98 to 103, 104 in an hour, that's when they seize. Okay? How quickly it changes.
but an adult
Shock.
that could happen and that won't
Yeah.
be okay.
Shock, right? Exactly the same. It's all the same thing. More shock, treatment, you know the treatment, right? It's exactly the same. SIDS. SIDS, right? We mentioned it a little bit earlier. No, we didn't. Did we mention it?
No.
It's
No.
nothing you can do.
No. SIDS, not usually past 2 years of age. Usually it's even not past 1 year of age. Yeah, usually in the morning, that's when we get those calls. Horrible, horrible situations.
Why is it most common in the fall and the winter?
What?
Why is it more common in the fall and the winter?
Don't know.
Oh, that's true.
Don't know.
It says.
Is there a cause for it?
No. No, we don't know.
It's
We
not.
don't know. There was the whole thing of put the baby back to sleep, put the baby sleep on its front, put the baby sleep on its back. Nobody knows. Nobody knows. In the old days, which one did they used to do? They used to put it on the stomach. Then they figured that it was rebreathing its own carbon dioxide, so that was causing SIDS.
Or they would choke, they were like.
Yeah, and now they're saying put it on the back. Bottom line is the best way for baby sleep is on its side. There's no way to keep it that way. So
Blankets.
no, you can't have blankets.
No, they have like these things that you put the baby in.
Okay, great. Trauma is the most common cause of death in children. Yes, right? Trauma. Okay.
Mesh.
Good.
Go back 1 second, please. Blunt trauma is the most common type of trauma. We talk about other types of trauma.
Yeah, penetrating.
roll over into it and they can't, or they can't.
Blunt's the opposite of penetrating. Child abuse and neglect, we've done this so many times, right? You're all going to be mandatory reporters. You know this? Very good.
Uh-oh.
Child abuse.
Ellie.
Mandatory reporters.
Self-reported.
Alright, and here's the law and the phone number again. And here's the law, and this is my favorite thing. This is my favorite law in New York State.
Drop them off
We
by
have
church.
a law called the Abandoned Infant Act.
Safe babies.
This means that instead of moms leaving unwanted babies in dumpsters, they can bring them to a fire station, to an EMT, to a hospital, okay, and leave the baby. Now, what you have to do is report it right away to the child abuse hotline, even if you didn't get any information from the mom, okay? So if they don't want the baby, we take the baby, obviously we just bring it to the hospital. You don't have to keep it, okay? Get whatever information you can.
You have to keep the baby until 13 years old.
Halacha Hashem Sabed, you picked it up first, you gotta return it. So you gotta keep it.
So you bring it to the hospital. Call the child abuse hotline. Even if you don't know who the parents are and all that, you just gotta report it, okay?
Do you know, so someone, I think on Solid, a kid fell down, the father was